All right, nursing students, let's talk about a situation you will absolutely face. Your patient's condition is taking a turn, their vitals are shaky, and that crucial order comes through: blood transfusion. It's one of the most powerful things we can do, but it's also packed with risk. So, how do we get this right, safely, every single time? So, let's break this down. A blood transfusion, at its core, is a lifeline. We're literally putting back what the body has lost. But here's the thing. We're introducing someone else's biological material into our patient. That's always going to be a risky move. And our job as nurses is to manage that risk with a flawless step-by-step procedure. So how do we go from just, memorizing the steps in a textbook to actually owning this skill? Well, the real key is understanding the why behind every single how. It's that critical thinking that makes a great nurse. And you can bet that's exactly what the NCLEX is going to test you on. To make this super clear, we're going to walk through it in 4 phases that pretty much mirror what you'll do in the real world. We'll start with prep, move to initiation, then monitoring, and finally documentation. And of course, we'll wrap it all up with the key takeaways you've got to know. Let's dive in. Okay, phase 1, the foundation. You might think the action really starts when that bag of blood shows up on the unit, but nope. The most important safety work happens right now, way before that blood even leaves the lab. Think of these 4 steps as your absolute non-negotiable pre-flight check. You're digging into the patient's record, you're triple-checking that doctor's order, making sure you have a valid signed consent, and, this is a big one, confirming you have a good working IV. These steps are your first and maybe your best defense against errors. Now, here is a number that you need to burn into your brain: 4 hours. The second that blood product leaves the controlled, refrigerated environment of the blood bank, a clock starts ticking. This is not a suggestion, it's a hard and fast rule for patient safety. It has to be infused or back in the lab within 4 hours, period. All right, our prep work is done, the order's been verified, now it's go time. This phase is all about getting your gear and your patient ready for a smooth, safe start to the transfusion. And here's your toolkit for the mission. You gotta have that special Y tubing with the filter, your bag of normal saline, the pump, all your PPE. Getting all of this ready beforehand means that when it's time to start, your focus is 100% on your patient, right where it needs to be. You know who your most important safety partner is in this whole process? Your patient. You have to empower them with knowledge. Clearly explain those early signs of a reaction, things like sudden itching, feeling chilly, or having a hard time breathing. And really stress how important it is they hit that call bell immediately if they feel anything at all that's out of the ordinary. So before you even think about spiking that blood bag, you've got 3 key things to do. 1, get that baseline set of vitals. This is your starting point, what you'll compare everything against. 2, hand hygiene and gloves. And 3, prime that wire tubing. And remember this, it's only with 0.9% sodium chloride. Anything else can actually damage the red blood cells. Okay, deep breath. We are now entering what I call the critical window. This is the most high-stakes part of the whole procedure. From this point on, your complete, focused attention is absolutely everything. This right here is the final and most important safety net of all, the 2-person bedside verification. You and another RN standing right there at the bedside, verbally and visually matching that patient's ID band against the blood bag tag. You're checking the name, the blood type, the unit number, everything. You read it out loud to each other. There are absolutely no shortcuts on this step, ever. Now, when we start slow, like really slow. Why? Because that first 15 minutes is when a severe reaction is most likely to happen. By going slow, we're minimizing how much blood the patient is exposed to in case something goes wrong. It's a built-in safety measure. This little schedule is basically your roadmap for monitoring. For those first 15 minutes, you do not leave that patient's side, and you recheck their vitals at the end of that period. After that, you'll fall into a rhythm of checking every hour, or whatever your hospital's policy says. This is how we catch problems early, before they become big problems. So what do you do if you see even the slightest hint of a reaction? A little rash, a complaint of back pain, a spike in temp? Your reaction has to be instant. You stop the transfusion. You don't just slow it down, you stop it completely. Then you'll disconnect that blood tubing and, with brand new tubing, start normal saline to keep that vein open while you get help and kick off your hospital's reaction protocol. So the last drop has gone in. The bag is empty, but you're not done yet. This last phase, the follow-through, is all about safely closing out the procedure and, just as importantly, creating that perfect, permanent record of what you did. Following these final steps just ensures a safe landing for everyone. You flush the line, you grab one last set of vitals to catch any delayed reactions, and you properly toss out the used equipment in the biohazard bin. It's about closing all the loops on this very high alert procedure. And the final piece of the puzzle is your documentation. This is the official, legal story of what happened. You have to capture the start and end times, that unique donation number from the bag, the volume given, and every single set of vitals. You know the saying, if you didn't chart it, it didn't happen. It's never been more true than right here.
Wow. Okay. We just went through the whole thing from start to finish. So let's take a second and boil this all down to the absolute must-remember safety pillars that you have to take with you into your practice.
So, what does it really mean to master this skill? It's not about just passing a skills lab test. It's about building these safety pillars into your muscle memory so they become the automatic habits that will protect your patients from harm for your entire career. Getting skills like this down cold is really the foundation of being a confident and competent nurse. So hey, if you found this breakdown helpful, do us a favor and hit that like button, share it with a classmate, and subscribe for more explainers just like this one. And I know a lot of you are deep in NCLEX prep mode. We've got you covered. Just check out the links in the description below for our summarized revision books. They're designed to help you walk into that exam feeling ready to go. Give that some thought as you keep studying. For me, it's always that two-person check at the bedside. Thanks so much for watching, and we'll see you in the next explainer.